Hey guys, Dr. Paul here. Tooth whitening is a quick, easy and affordable way to improve the look of your teeth. The main downside, however, is the possibility of your teeth becoming sensitive. In this video, I'm going to give you 9 tips, actually we'll make it 10 tips, to reduce the chance of this happening. Now the research shows us that about 50% of the population will experience sensitivity from whitening, especially people that already have sensitive teeth to begin with. Does this mean that you shouldn't whiten? Well no, it just means there are certain steps you should take to try to reduce the chance of that happening. Now tip number 1 is to first see your dentist. There may be a few reasons why you're not actually a suitable candidate for whitening, and you won't know this without visiting them. There's also certain treatment that they can do to actually prevent that sensitivity from happening before you start whitening. Now the next tip is to use a sensitive toothpaste. You'll want to use this for about a week up to 2 weeks before you actually start whitening. It goes back to the saying, prevention is better than cure. If you can reduce the sensitivity before it starts, then the risk is going to go down. Now you'll want to use it morning and night time, and after you finish brushing, don't actually rinse your mouth with water. Instead, just spit the toothpaste out, which leaves a little bit of it in there to help with that sensitivity effect. Now an extra tip, if you have teeth that are extra sensitive, get a little bit on your finger and actually smear it on those teeth that are sensitive before you go to bed, and then just leave it. Now the third tip is to not whiten your teeth every day. So when you actually look at a pack, it'll tell you to whiten for say 2 weeks, and it'll tell you to do it every single day. I'd say for the start, don't do that. The reason being is that sensitivity sometimes starts after 24 hours. So if you whiten again within this period before your teeth become sensitive, they can be double sensitive, and you really don't want that. Trust me, I know from experience. Now if you find that you don't have sensitive teeth that next day, then you should be okay with doing it every single day. Now the next tip is similar to the last one, and it's to not actually whiten your teeth for the full recommended time to start with. Now the longer the bleach is actually on your teeth, the more likely it's going to become sensitive. Now in the beginning, if the packet says 4 hours, well maybe only do 2 and see how your teeth react. If you find that after doing that for a day, your teeth are okay and they're not sensitive, then you can slowly creep it up to getting to that 4-hour mark. Tip number 5 is to not use the whitening material for longer than the recommended time. They have these recommendations for a reason. If you go longer, the chance of you having sensitivity is much higher. It happened to me once that I did it overnight and I was using my Invisalign trays. Now I don't actually eat breakfast, so I left them in from say 10 p.m. until lunchtime the next day. I took them out, had lunch, everything was okay. That afternoon, severe sensitivity. But don't worry, I'll tell you how I combated that in the next few tips. Tip number 6 is to look into sensitivity strips if you find that your teeth are sensitive. You can buy them from the chemist or online. Basically, it's a strip that you put over the top of your teeth to try to reduce that sensitivity. Not everyone needs it, but it is a good thing to have if they are sensitive. Now tip number 7, it's an alternative to the strips, and it's the same sort of premise. If you find that your teeth are sensitive, get a little bit of sensitive toothpaste, smear it on the teeth that you do find are sensitive, and then put your whitening trays in over the top of that. You'll find that you almost get instant relief, and this is what I use if my teeth become sensitive. Tip number 8 is for people that know they have sensitive teeth. Now for you want to go to that next level protection, and that is from a product that has in it Amorphous calcium phosphate. Basically, the research shows that this can help seal off that enamel layer to prevent the sensitivity, and it's very effective at doing that. One example of a product that does contain that is Mousse Plus. It also contains fluoride as well, which also helps reduce the sensitivity. I'll include a link in the description for that, and I do highly recommend it if you do suffer from sensitive teeth. Now tip number 9 is the last tip. Speak to your dentist if you find that the sensitivity continues or it increases, because there are things that we can do for you. There are sealants like high concentration fluoride that we can smear over the top of the teeth that are sensitive, or as the very end degree, if your teeth have actually had some wear near the gum line and they're sensitive in that area, we can actually seal those areas with some very small conservative fillings that will stop your sensitivity in the future. So our last tip is to make sure that you follow these rules, especially if you're doing in-office whitening. In-office whitening, it's much more likely that your teeth will become sensitive. So these tips are even more important. When patients come to do in-office whitening with us, we make sure that they follow these protocols leading up to it. And then after we finish the whitening, we'll actually place some of that desensitizing gel directly onto their teeth. So please, wherever you go, make sure that they do have a protocol for before and then right after whitening as well. So to summarize, tip 1 is to see your dentist before whitening. Tip 2 is to use sensitive toothpaste prior to whitening. Tip 3 is to not whiten every day to start with. Tip 4, don't whiten for the full amount of time to start with. Tip 5, don't whiten more than the recommended time. Tip 6 is to try out sensitive strips if you find that your teeth are sensitive after whitening. Tip 7 is the same sort of idea, but you're going to use sensitive toothpaste over the top of those sensitive teeth, then put your whitening tray in over the top of that. Tip 8 is to use a product like Tooth Mousse that has amorphous calcium phosphate to reduce the sensitivity. Tip 9 is to see your dentist if the sensitivity persists or it gets worse. And tip number 10, please make sure that you follow these tips even more strictly if you're going to be doing in-office whitening. Anyway guys, thanks so much for watching. I hope you got something out of the video. If you did, did, please like, share, subscribe. Those things really help me out a lot. And if you have any questions, put them in the comment section. I always endeavor to get to them within about 24 hours. Have a great day and keep on smiling.